Hi, good morning. Welcome to Intellect Medicals. I'm Dr. Chirag and this is our first live video for you guys, and the topic is bag and mask ventilation. Now, talking about the indications of this bag and mask ventilation, first and foremost is hypercapnic respiratory failure. Second, if a patient is in hypoxic respiratory failure. Third, if a patient is apneic. And fourth, whenever the patient has to undergo some kind of surgeries, mainly the pre-op. So these are the major indications of this bag and mask. This is a very important topic for you guys. Now, talking about the equipments which we use in bag and mask ventilation is mainly, first of all, a proper size mask and a self-reinflating resuscitation bag. As you can see, this is self-reinflatable. That is why it is called as self-reinflating resuscitation bag. Now, the important thing is the placement of this apparatus, the bag and the mask. Now, how to place this bag and mask onto the face of a patient? First of all, you have to attach this bag to the mask. Now, this apex of the mask will go at the bridge of the nose, as you can see, and the lower margin of the mask will go in the groove between the lower lip and the chin, like this. So this is how you place a mask onto the face of a patient. Now, after placing the mask, you have to hold this mask in a C and E technique. As you can see, my index finger and thumb is making a C. This C stands for compression of the mask onto the face of a patient. And these three fingers are making a E. So these three fingers should be at the bony prominence of the mandible. And the last finger, the finger, to be kept at the angle of the jaw, so as to elevate this. These three making a E stands for elevation of the jaw. So this is how you elevate the jaw. And simultaneously, to make the airway patent, you have to do a head tilt. All because whenever the patient is unconscious, tongue falls back onto the pharynx. So as to prevent that and so as to make the airway patent, you have to do this head tilt along with your C and E technique. Now, after placement of the mask, you have to give 2 breaths to the patient. 2 breaths to be given over 3 seconds. Now see how the breath to be given. 1001 to give the breath, 1002 relaxation, and 1003 again a breath. So this is how to be done. 1001, 1002, 1003. 1001, 1002, 1003. And simultaneously, you have to see the chest rise of a patient. So this is how a bag and mask is to be given to the patient. Thank you guys for watching this video.